I will update in my YouTube channel these recorded sessions you can take. Okay. Are you able to see my screen, right?
Yes,
Yes,
sir.
sir.
Yeah, everyone. Thank you for confirmation. So remember, guys, it was coding related guidelines. Okay, inpatient coding related guidelines present on admission reporting guidelines. 3 multiple choice questions you will get. Okay, here no coding, nothing, only guidelines. 5 indicators you will get. Okay. First thing, where we need to use these guidelines. These guidelines are to be used as supplement to the ICD-10 CM official guidelines for coding and reporting to facilitate the assignment of present on admission indicator. For each diagnosis and external cause of injury code, reporting and claims form UB04 and 837 institutional. So remember this UB04 claim form for inpatient coding. Okay. These claim form we need to submit for inpatient coding. So which means these POA indicators you need to assign for ICD-10 CM codes for diagnosis codes and external cause of injury. Both. Okay. ICD codes. Diagnosis and external cause of injury. Both diagnosis codes you need to assign POA indicators only for ICD codes, not for procedure codes. Okay, only for diagnosis codes. Clear? These codes you need to assign in inpatient setting for diagnosis for ICD codes. So total 5 indicators will get. Okay, so all claims involving in inpatient admissions to general acute care hospital or other facilities, any hospital in inpatient setting, you need to assign these POA indicators. Okay, when we need to assign, next check. Okay, next thing. Patient on admission is defined as present at the time of order of inpatient admission occurs. Sir, present on admission. Present on admission defined. What is the meaning of present on admission means? Okay. At the time of inpatient admission occurs. Okay. The condition present at the time of inpatient admission or the condition develops after the inpatient admission. Okay. So when the condition develop to the patient, present at the time of inpatient admission or the condition develops after inpatient admission. This is the important thing. Now tell me what is the meaning of inpatient?
The patient which are admitted in the hospital.
Who are
Present
admitted in
on
the
admission.
hospital stayed
24
more
hours.
than 24 hours.
More
Okay.
than 24 hours.
Who stays in the hospital more than 24 hours? You called as
Inpatient.
inpatient. Charged within 24 hours, we called as outpatient. Okay. So now we are going to admit as inpatient. At that time, if the condition present or not, we need to check. Based on that, you are assigning to these indicators. Okay. So remember, when the condition have conflicting, like issues related to inconsistent, missing, conflicting, or unclear documentation, must still be resolved by the provider, which means we are unable to identify that condition when developed prior to the inpatient or after admitting. Based on the documentation, we are unable to determine document was conflicting, okay, missing, then you need to get the clarity from the provider. Okay, you should not assign any indicator whatever you want. You need to get the clarity if the document really need conflicting or missing or unclear documentation. Okay. If a condition would not coded, if you are not coded any condition, okay, if you are not coded any condition, then no need to assign POA also. If a condition would not be coded, so which means while you are assigning a ICD code, for that only you need to assign POA indicator. Okay, total 5 indicators we have. Y, N, U, W. Please note down these indicators. Y, N, U, W and E. E also. What is the meaning of Y? Definition. Present at the time of
Admission.
inpatient. N. Not present at the time of inpatient admission. U. Document was insufficient to determine if condition is present on admission or not. W. Provider is unable to clinically determine whether the condition was present on admission or not. Okay. So, if the condition present at the time of inpatient admission, for all the diagnoses, you need to assign Y indicator. The condition was developed during the hospital stay. Okay. After admitting in the stay, if inpatient means sometimes we'll stay 2 days, 3 days, 1 month also in the hospital. So while you are staying in the hospital, any condition developed to you, you need to assign for that conditions N indicator. Okay. Then while you are reading the document, you are unable to identify the POA status, whether Y or N. Document was insufficient to identify. Then you need to assign U indicator and you need to get the clarity from provider. Okay. When you are assigning U, you must be get the clarity from provider related to POA status. So after assigning U, you send back to provider. Now provider states, I am also unable to determine. Provider also unable to determine means what indicator you need to assign? W. W. Okay. If provider states that was Y or N means you need to change to Y or N. If provider states I am also unable to determine W. So here remember while you are assigning U indicator, you must be penned the document. You should not complete the document. Okay, you need to get the clarity. Clear?
Yes, sir.
So,
Yes.
any doubt up to now? Anybody not understanding single thing?
Sir, E indicator means
E I will tell. E means for Z series status codes. Okay. Z series status ICD codes. Only simple thing
okay.
Z series. While ICD start with Z, you need to assign E.
Okay.
Okay.
Can you repeat the Y and N?
Yeah, Y and N. Suppose while you are going to the hospital with some conditions, okay? Suppose a patient going to the hospital with fever and SOB. Okay, patient have fever. Then they identified your fever temperature was very high. They was given admission. They are asking to stay in the hospital like 2 days, 3 days. At the time of admission, patient already have hypertension, diabetes, like some diseases. Okay, you got it right. Already some chronic diseases have a patient hypertension, diabetes, heart failure, whatever it. So for that, you need to assign Y. After admitting, now patient was admitted with fever. Okay, after admitting, they are treated with the fever through antibiotics. Okay, they are admitting patient.
I am unable to hear your voice.
Your voice is
Device
breaking, sir.
do not have auto.
You mute itself.
Sorry. Now
Yeah,
Now
it's
audible,
clear.
sir.
thank you, thank you. Yeah, it will go went to
Yes,
mute.
yes.
Sorry. So Y and N means, remember, patient coming with fever to the hospital. Okay. Now patient have already hypertension and diabetes. Now coming with fever. They give an admission to the patient. So what indicator you will assign for this diabetes and hypertension fever?
Yes.
Y
Y
indicator. Yes, right? Because these conditions present at the time of inpatient admission. Okay, already present to the patient. Now they admitted with fever. Okay, they started treatment to fever and through antibiotics. They given antibiotics to control the fever. Now suddenly developed allergic reaction. Okay, suddenly developed allergic reaction. So for that allergic reaction, you will assign Y or N.
Yan.
Then
Why? Because
after
They
the
did not
visit,
treat
they
at the
will
end.
diagnose it.
The condition developed after that.
Condition develop
developed
after
after
that.
the admission. So if at the time of admission that condition was not present, right? That allergic reaction not present at the time of admission. It was developed after inpatient admission. Clear? When you need to assign Y or N.
Yes, sir.
Right.
Thank you. So next guideline, remember time frame for POA identification. Read the first guideline. Here you will get one multiple choice question in this concept. What is the time frame to assign the POA indicator? They will ask. Okay. They will give in options like 15 days, 20 days, 30 days, and unlimited. Okay. So what is the guideline? Read the first line. There is no required time frame as to when a provider must identify a documentation condition to be present on admission. So is there any time frame to assign the POA?
No.
No. Okay. So unlimited time frame or no time frame we need to select. Please write down this question. Okay. What is the time frame to assign POA indicator? Unlimited time frame or there is no time frame. Okay. Remaining options they will give 15 days, 20 days, 30 days like that. Okay. This question you will get in exam. Any doubt in this question? What is the time frame to assign POA indicators?
Tell me again question.
What is the time frame to assign POA indicator?
No time frame.
unlimited.
Yeah, unlimited or no time frame depends on the options. In the three options, they will give some days like 15 days, 20 days, 5 days, within 24 hours like that. One option they will give no time frame or unlimited time. Okay, you need to select no time frame or unlimited. Everyone written that question, right?
Yes, sir.
Yeah, thank you for the information.
Yes.
So one question we covered for the exam up to now. In this concept, we will get three now. One question we covered. Next concept, come to the guidelines. Okay. So first thing, if POA explicitly documented, which means providers directly stay saying that condition present at the time of admission, then you need to give Y. If provider directly saying that condition not present on admission, then you need to give
N.
N indicator. Okay. N. Y. Then conditions diagnosed prior to inpatient admission like hypertension, diabetes, asthma, some chronic conditions, lifelong conditions patient have. No? For that conditions already present at the time of admission. For that
Why?
condition, what we need to give?
Why?
Y.
Y indicator. Okay, Y. Clear, right? Up to now?
Yeah, clear.
Everyone.
Yeah, clear.
So guys, please remember, if you have any doubt, please stop me immediately. After completing everything, Don't tell me I didn't understand anything. Please explain again. Okay. Now only immediately you can stop me. Okay. I will explain multiple times. But don't tell me after completing everything, I didn't understand anything. Please explain again. Okay. I will give recorded session. Next, conditions diagnosed during the admission, but clearly present at the time of.
No, Siva, your voice is breaking.
Sorry, bro. Next concept. Conditions present. Okay. Conditions present clearly at the time of admission. Okay. But it was evaluated after admission. For that,
Assign Y indicator.
assign Y indicator. Condition diagnosed during the admission but clearly present before admission. So I will give some examples. Now then you will understand. Suppose patient going to the hospital with fever, SOB, cough. Okay, you are admitted going to the hospital. Then based on your situation, they given inpatient admission. Then they done evaluation and they identified you have pneumonia. Okay, they identified you have pneumonia. So what indicator you will assign for pneumonia now?
Y.
No,
Anybody?
no, because they find
Anybody an indicator?
Symptoms related to pneumonia, we can assign Y.
Hmm. So guys, suppose if you are going to any hospital, we can tell our condition or our symptom to the physician or doctor. Generally, now we are going to a hospital with so and so fever, stomach pain, headache. You will tell your symptoms to the patient, right? Yes or no?
Yes, yes.
Yes.
Okay, we can express our symptom to the patient, then physician. Then physician will do evaluation. They will do workup based on your symptoms. Suppose you tell I have stomach pain, then they will do CT abdomen. Okay, then they identified you have gastritis. Okay, you have gastric ulcers in your stomach. Okay, then that ulcers was developed in the hospital or clearly you have, but it was evaluated in the hospital.
Already present.
Priorly it is.
Clearly it is, but it was evaluated in the hospital. Okay.
Yes.
It was not developed in the hospital, right? It was just evaluated. They identified after admission. Okay. So for that condition clearly present at the time of inpatient admission, but it was taken time to evaluate. For this type of conditions, you need to assign Y indicator. Okay, for this type of conditions, you need to assign Y indicator. Clear?
Yes, sir.
yeah,
Yes.
clear.
Yeah. You are getting my voice, right?
Yes, sir. Clear.
Yes.
Yeah, thank you.
Getting.
Thank you. Any doubt up to now?
No, sir.
No.
Thank you. Next concept. Conditions develops during outpatient encounter prior to inpatient admission. This concept we can discuss. It was interesting concept. Okay. So while you are going to hospital, they will give directly inpatient admission.
No.
No.
No, sir.
No.
So when they will give inpatient admission?
When there is any serious.
Based
For
on your
acute condition.
situation, based on your condition, emergency, they will decide, right? Physician will decide, right? Doctor will decide whether they wanna give admission, they wanna admit or not. Correct?
Yes, sir.
So now, how we will go to hospital? Generally, tell me. How you will reach a hospital? Not by auto like that. After going the hospital, how you meet the physician?
Through appointment.
Yeah, you will take a appointment.
Registration,
Then
appointment registration.
you can take a appointment. Then you will meet the physician. Okay.
We'll
Then
tell the symptoms.
yeah. Sometimes emergency, like injuries happen. Okay. My heart stroke. Okay. Emergency. At that time, no need appointment, right? Directly you can go to the hospital, na? Emergency department through emergency. Okay. In every hospital, you can observe, right? Emergency department. Directly
Yes.
they will go to the hospital. They can't wait, na? Based on their situation. Okay. Through emergency department, you can go to the hospital. Through appointment, we can go to the hospital. So now, while you are going to the hospital through appointment, you are waiting in the hospital lobby. Okay, you are still not meet the physician. Okay, you are just wait in the hospital lobby. In the hospital lobby, developed a condition. For that condition, what indicator you will assign?
Why?
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 Why
N,
indicator?
N,
Okay,
N.
why indicator you need to assign? Yes, only. Why? Because until you get the inpatient order, still you will consider as outpatient. Okay, you don't know, right, whether they will give inpatient admission or not. Okay, you are wait in the hospital for appointment. At that time, you are not a inpatient. They will decide and they will written order. They will give from this time onwards you can admit in the hospital, like that. They will tell, right? They will give inpatient written order. Okay, please admit this patient from this time, like that. Okay. Inpatient written order time onwards, you are a inpatient. Before that, you are in a hospital. Still, you are considered as outpatient. Okay.
Yes.
Condition develops during outpatient encounter means until you will get the inpatient admission, you will be considered as outpatient. In this type, if any condition develop to the patient, you need to assign Y indicator for that condition. Clear?
Yes.
Yes, sir.
Yeah, thank you. So tell me the first question answer. Patient present to the hospital to ED for CHF, got fractured in ED, moving to IP. What is the POA assignment for these conditions?
Y for fracture and CHF.
Y for CHF and
Fracture, correct? Both are Y because got fractured in ED, right? So
yes.
before the inpatient admission only, patient
Yeah,
got
answer.
fracture. Option B correct. Y for fracture and CHF. Anybody disagree? Any concern in this concept?
Sir, ED is also part of inpatient, na?
Before moving to the IP, ED was outpatient department, okay? Emergency department was outpatient. That only, it was in the part of IP. But when they are asking what indicator you will give in the emergency department, it was outpatient, okay? ED was outpatient. It will comes under inpatient record, you are asking, right? You will see while you are working on IP record,
Sir.
you will get emergency department note, right?
Yes, yes, sir.
That's it, no? Yeah, but actually what happened now? In the IP record, they will give what the things happen and prior to get inpatient written order, okay? For
Yes.
that, you give just indicator Y. We need to code that condition, but you give indicator Y. They're asking. Only ED department means it was comes under outpatient department. Okay.
Yes, sir.
So next, documentation does not indicate whether the condition was present on admission or not. What indicator you need to say?
Unknown.
Unknown. U.
U.
Simple guideline only. Then provider unable to determine the indicator.
W.
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 So, please write down the question. Here you will get one question. Okay. Provider states, I am unable to determine the POA status of the condition. Okay. Provider states, I am unable to determine the POA status of the condition. What indicator you will assign in this situation? What indicator you will assign in this situation?
W.
Answer was W. Okay. W. Clear? This question also you will get in exam. Provider unable to determine W. No time frame for assign the POA. Two questions we covered. Now, these are the important topic. Codes that contain multiple clinical concepts. Okay. These guidelines important, guys. Here you will get one question also. Assign N if at least one of the clinical concepts included. Okay. Assign N if at least one of the clinical concepts included in the code was not present on admission. Okay. So read these examples. In this you will get one question. Please note down that examples. Okay. They will ask that guidelines only. COPD with acute exacerbation and the exacerbation was not present on admission, which means patient coming with COPD. After admitting, it was exacerbated. What indicator you need to assign? N. Then gastric ulcer that does not start bleeding until after admission, which means patient coming with gastric ulcer after admit it was bleeding. What indicator you need to assign?
N. N.
N. Asthma patient develops status asthmaticus after admission, which means patient coming with asthma after admission, it was going to status asthmaticus. What indicator you need to assign?
N.
N.
N. Okay. Here you will get one question that was gastric ulcer. Okay.
So can you explain again?
Yeah, I will explain. So please solve the fifth question. This question you will get in exam.
Answer is N. N.
N only. N.
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 N, right? Clear? So now I will explain again. So nothing here. You need to read these three things. Okay. These three things. Examples you need to read. Here you will get one question. Patient coming with COPD. After admitting, it was exacerbated. You need to assign N. Patient coming with gastric ulcer. After admitting, it was bleeding. N indicator. Okay, then patient coming with asthma. After admitting, it was going to status asthmaticus. N indicator.
Okay.
Okay, noted. Here one question. So total 3 questions we covered up to now. That 3 questions you will get in exam. Okay. This 5th question you will get in exam. Now what we discussed. Gastric ulcer. This question. Patient admitted to the hospital with gastric ulcer. After admission, patient developed bleeding. What is the POA for this report? N. Okay. Then time frame to assign POA unlimited. Then provider unable to determine
Unable to determine POA condition.
W. Okay. Clear? Next concept. Obstetricals, like pregnancy. How we need to code. Remember guys, same guidelines for pregnant also. If the condition develops after admission N, before at the time of admission condition present Y. Okay. Then perinatal means newborns. Okay. Newborns, how we need to code check. Newborns are not considered to be admitted until after birth. Okay. Until after birth, we should not code separately as the newborn. Okay. After the birth only you can consider as newborn. Okay. So here, any condition develops by birth. Okay. By birth, any condition develops, you need to assign Y. Okay. Any condition present at that birth or that develop in utero means during the delivery. Okay. Consider as present on admission Y. If the condition develop during the delivery process, like any injuries happen, okay, or streptococcal B will affect exposure on vaginal canal or meconium aspiration, these conditions you need to assign Y indicator. Any condition develops by birth, okay, by birth defect, you need to assign Y indicator, okay. Clear? These are the POA guidelines. Here you will get 3 multiple choice questions. Any difficulty to assign the POA?
During birth, we can assign N, na sir?
Why no? By birth, any condition develops Y. During the birth, in utero, any condition. After the birth, okay, after the birth, after the admit in the hospital, like after the delivery, after the birth, any condition develops, then N. Okay. After
Okay, sir.
3 hours, 4 hours, then N. By birth, Y. Clear? Now solve some examples, guys. Yeah. Tell me 23rd question answer. A woman is admitted to the hospital with exacerbation of COPD and mentioned a lump she has noticed in her right breast. On the 4th day of her hospitalization stay, a biopsy is done for the breast lump and diagnosis a ductal carcinoma is made. What is the POA for carcinoma?
Why, sir?
Y only.
Everybody agree with Y or anybody N?
N.
Why, sir?
Who are having Y, no issue. Who are saying N? Why you are selecting N indicator? Tell me.
After admission, they are noted
After developing only.
See guys, patient have lump, right? Correct?
Yes.
At the time of admission,
Yes.
patient have noted lump, right, on right breast. Okay, they feel it was a lump. Okay, then they taken biopsy, means they collected the sample on the lump. Then they identified that was not a lump, it was a cancer. They tell. Then cancer was not developed in the hospital, right? Cancer such easily will not develop, right?
Yes, sir.
Right. Okay, cancer, how will it develop immediately? It was just evaluated. They identified it was a not lump, it was a cancer, they tell. So that cancer was present at the time of admission, right? Previously patient have cancer, correct?
Yes.
Okay, cancer what not like infection, it will not develop immediately, right?
Yes, sir.
Even some years we can't able to identify we have patient have cancer. Okay, that symptoms will not show immediately, no cancer symptoms. Yes or no?
Yes.
You
Yes.
agree with me, right?
Yeah.
Yes.
Answer we can't recognize on the same day, right? We can't able to recognize. Okay, it was very difficult. After showing the symptoms was showing after the some years, stage 1, stage 2. At end stage only it will show symptoms. So Y indicator. Remember for cancer, Y. Cancer will not develop in the single day. We can't able to identify directly. Okay. Then tell me 20th question. A patient has hernia repair done as an outpatient. In recovery, the patient develops tachycardia and shortness of breath. Is diagnosed with post-operative AFib and is subsequently admitted. What is the POA indicator for post-operative AFib?
No.
And
N.
One more time, you people can read the question.
Y
See
indicator.
here, a patient has hernia repair done where it was done.
Outpatient.
Outpatient.
The
Outpatient.
procedure performed in outpatient, right?
Yes.
yes,
In recovery, patient develops tachycardia and SOB and is diagnosed with post-operative AFib. So, post-operative AFib where it was developed and it is subsequently admitted. After the post-operative AFib, for the reason of post-operative AFib, they are admitting. Correct here? After
Yes.
developing post-operative AFib, subsequently they are admitted. Then what is the POA for post-operative AFib?
Y.
I,
Y
Y.
indicator, guys.
Why?
Why not?
Why?
Why? So read the question carefully and understand. This is the twist, okay? So patient was admitted here outpatient for the procedure. For due to the post-operative complication, they are going to inpatient admission. Okay? Clear, right?
yes,
So next, tell me 21 question. Patient is admitted with acute gastritis. On the second day of admission, patient has hematemesis. Patient also being treated for long-standing hypertension and diabetes, along with recently diagnosed hypothyroidism. Which of the diagnosis will be have POA-N?
Hypothyroidism.
hypothyroidism.
Guys, recently diagnosed hypothyroidism, they are saying. Then why will be N? Recently means from previously diagnosed.
Hematemesis.
Hemostasis.
See,
Hema-
on the second day of admission, which means after admission, second day, they identified patient has
Hematemesis.
hematemesis. What is the N indicator here?
hematemesis.
Gastritis with bleeding. Okay. Bleeding, hematemesis means bleeding. Clear? Huh?
yes,
Yeah. 20, 21, 22. Tell me. Twentieth. A female patient is diagnosed with congestive heart failure and also has stage 4 ulcer. Which of the following POA indicator must be present? So the ulcer. What is the POA for ulcer?
S.
Y.
Why?
Why?
Because patient, they are telling directly patient diagnosed with heart failure and ulcer. So why? They are clearly showing. Then understand the second question, okay? An inpatient, okay? Patient was inpatient, undergoes a procedure. After the procedure, develops post-operative complication. What is the indicator you will assign the post-operative complication now?
N.
N.
N
and
indicator. Okay? N indicator. Because here patient was already inpatient. Previously, you seen patient was outpatient. They done procedure and after the post-operative complication, they admitted in the hospital subsequently. That's why you given Y. Here patient was already inpatient admitted for the procedure. Then you need to assign for post-operative complication what indicator?
N.
N indicator. A. 22 question.
Y indicator.
22.
Y
Sir,
indicator.
sir, 21 question.
Mhm.
N indicator for 22.
22 young.
Some
22 Y,
1
sir.
minute.
And only.
Yeah,
Sir,
yeah.
1
Give me
minute.
1 minute. Some people have 21 doubt. Tell me.
Yeah. So, yeah, sir, I know it is Y,
Mm.
but actually, no.
No, it was N. Why you need to give
N
1?
kada, sir, yeah.
Mm.
But the question is about what is the reason for the reduced reimbursement annaru.
Yeah,
That
it
means,
was like, see, they are giving some twist for that, okay? That's not related to the question, okay? They are asking just extension of that question. They are twisting us,
but
okay?
in the extension they asked like, so
Mm.
wrong answer istene kada takku reimbursement ayi untadi.
They are not asking like that.
Oh,
Wrong answer, if you give wrong indicator, then you will get claim reject, okay? They won't pay if you give wrong option, okay?
okay.
See, when you are giving wrong options, the claim will reject, okay? It will come back again to assign properly. They won't pay minimal amount.
Okay, sir, I got you.
So what is the answer for 20?
20, why? Option B. Because patient present with two conditions, no? Congestive heart failure and stage 4 ulcer. They are asking what is the POA for ulcer. Why? Both are present at the
Okay.
time of admission, right?
Got it.
They are diagnosed with conditions, no? So now 22.
No, because
And
acute exacerbation was diagnosed in third day of the admission.
So guys, read the question carefully here. A patient admitted with COPD, okay? Patient with COPD. Give me 1 minute. Patient with COPD is admitted with an exacerbation of systolic heart failure. Okay? This exacerbation for systolic heart failure, okay? On day 3 of the admission, the provider documents the patient now is experiencing an acute exacerbation of his COPD. Okay, on day 3, they are experiencing COPD exacerbation. What is the POA status now?
N.
N.
N. Okay,
N.
N. Clear? Huh? So here that exacerbation was related to systolic heart failure, guys.
Y.
Sorry, patient was admitted with acute exacerbation. It is considered as S.
I didn't get you, bro.
Patient is admitted with an acute exacerbation of chronic systolic heart failure. On third day, the providing patient now is expecting an acute exacerbation of COPD.
They are asking what is the indicator you will assign for COPD exacerbation. No?
S only.
Why you will give S?
Because patient was admitted with acute exacerbation.
Bro, for acute exacerbation for which condition having? At the time of admission, acute exacerbation of CHF, right?
Okay.
Got it. Huh? If patient have exacerbation means you need to check that exacerbation for which condition having.
Bro, I have one doubt. Previously, you told COPD with exacerbation and asthma with exacerbation after admission. That time we take N, right? The same
Yes, right.
scenario, this one also.
So
That's
also
why
I'm
I'm
saying
asking.
N only answer, right? Here also N
Yes.
was the answer. Who said
No.
why?
That time I think why. You can show me that previous one, please.
N only I show.
N only.
Okay, N only. N only I show, no? See, assign N.
Okay,
Keep at least
okay,
one of the
bro.
clinical concepts, okay? N only I said.
Okay, bro. Okay, thank you, bro.
Clear, everyone?
Yes.
Yeah, thank you. Who are not able to join due to issues, see, please remember, I will send the link in the group. Okay, please cross check. That's the best option. Because sometimes I will change the link. Okay. Don't expect same link. You can check in WhatsApp group. I will share the link. Okay.
In which group, brother?
Who all are not in the group, please ask me. I will add in the group. Okay. Clear, right? I share. Maybe I added in any one group means no problem. If you are not in any single group, who all are admin me, then you can text me simply. I will add in the group. Okay.
I have one question.
Yeah.
So,
If patient is admitted with suspected COPD exacerbation after examining by the provider stated the patient has COPD. In this case, Y indicator for COPD? No?
Patient suspected the condition. Then they identified the condition. Correct?
Yes.
Okay. They at the time of admission, they are just suspecting, not confirming. After admission, they are confirming. That's it, right?
Yes.
Y indicator you need to say. Okay. Why they will because suspect? Because they are expecting this based on the symptoms, they will suspect the condition. Okay. Then they confirmed after the admission.
Okay.
Simply they can't suspect right for any condition. Based on the workup only they will suspect.
Okay.
Any doubts up to now?